Welcome to this special edition of Cystic Fibrosis Review. I'm here with Dr. Marianne Muhlebach from the University of North Carolina at Chapel Hill. We're in Dublin at the European Cystic Fibrosis Conference. Welcome, Dr. Muhlebach.
Thank you.
You've been speaking at the conference about MRSA, or Methicillin-resistant Staph. There seems to be a lot more interest in this organism recently. Why is that?
So I think a large component of this is that there are a large number of cystic fibrosis patients, as we see in the registry, that have MRSA. Additionally, MRSA is also seen in non-CF patients and is a concern for hospitals because it's transmissible.
You presented data at the conference about the epidemiology of MRSA. Can you tell me about that study?
Yes, this is a study conducted through the University of North Carolina, funded by the CF Foundation, where we had 7 sites, and we looked at the prevalence of different types of MRSA, as well as antibiotic susceptibility patterns.
And did you see a difference between the centers and the prevalence of MRSA?
So we chose the prevalence based on pre-existing data that we knew they had a high prevalence, and at those centers we did not see differences in terms of antibiotic susceptibility patterns between the different centers or between the types of MRSA that were seen at the different centers.
And was the MRSA, were the strains more from a community-acquired strain, or were they a hospital-acquired strain that was most common?
So the most common across all the sites were the hospital-acquired strains. The community-acquired strains are present in about 1/3 of the patients.
And what about resistance? Was there any difference in resistant patterns among the centers?
Not between the centers. There was not a difference in patterns. There's definitely differences between different types of antibiotics, as to be expected.
Certainly. Well, thank you very much, Dr. Muhlebach, for joining me today. And thank you for watching this special edition of Cystic Fibrosis Review from Dublin, Ireland.